So the first steps after you get your catheter out following robotic prostatectomy is to start doing your Kegel exercises. Okay? The Kegel exercises are the same exercises that women do after having a baby that help regain sphincter control and tension. All right? So how do you do a Kegel exercise? The first thing you do is don't squeeze your butt cheeks, but squeeze your butthole. Squeeze and hold as long as you can, relax, squeeze and hold as long as you can, and relax. 3 sets of 15 every day. There's also, like everything else now, there's an app for that. So look at Kegel Nation. It's by the University of California, San Francisco Urology Department. It helps you track how strong your sphincter muscle is getting. I strongly suggest that. And you're gonna do Kegel exercises until you get your urinary control back, okay? And we can talk about what the expectations and duration for that are. The next step is rehabbing the erections. So there is a couple of options to do this. The first thing we usually do is start with a PD5 inhibitor. This is your Viagra or Cialis. The Viagra can be taken on demand, usually a couple of times a week. Same with the high-dose Cialis, 20 milligrams a couple of times a week. You may also want to consider the daily Cialis, which is 5 milligrams a day, and you don't have to take it on. And what do these medicines do early on is they help promote good blood flow back into the penis so we don't develop scar tissue on the inside, okay? And then we can move on from there at the 6-week or the 3-month visit. Your cancer surgeon should be focused on both your recovery as well as your cancer control. But sometimes this may get left behind. It's really important that a man understands he deserves the whole package. Good cancer control, getting his erections back, and getting his urinary control back. And a men's health specialist may help you focus on the latter two as being just as important. Prostate cancer treatment can impact sexual function in 2 ways. And it's important to remember prostate cancer treatment includes radiation, surgery, and proton therapy, okay? The blood flow and the nerve supply to the penis both run right through and next to the prostate. And for instance, when the prostate's removed, sometimes the cancer requires the nerves to be removed with it. Sometimes the nerves can be spared. Nerve sparing promotes a quicker and more likely chance of erectile function recovery. However, radiation and proton can also impact the nerves that surround the prostate as well as the blood flow, resulting in reduced sexual function. Prostate cancer treatment, both radiation and surgery, can affect bladder function. For prostate surgery, your bladder control is dependent on 2 mechanisms, the internal sphincter and the external sphincter, the muscles that hold the urine. When you remove the prostate, the internal sphincter is removed with it. The external sphincter becomes weak. And after prostate cancer surgery, that's why we recommend the Kegel exercises to help strengthen and regain urinary control after prostate surgery. Now, radiation affects the prostate in a different way. Radiation causes the prostate to swell, as well as bladder irritation, and can cause overactive bladder, urgency, frequency, getting up at night. And that can be treated and managed with adding an alpha blocker such as Flomax or Uroxetrol, as well as bladder medications such as Myrbetriq, Ditropan, or the newer agents Gemtesa and Vesicare. So if it's whether it's radiation or surgery, both can affect your bladder function, and we have effective treatments for both. The recovery process following prostate cancer treatment is varied by the individual and the surgeon. But generally, after surgery, the catheter comes out in 4 to 10 days, and once a catheter comes out, urinary control is the first priority. We'll have you start doing Kegel exercises, and somewhere between 3 and 6 months, most men will be dry, and by a year, 90% will be dry. For erectile function, The first step is to start the oral medications such as Cialis or Viagra and give that 6 weeks to 3 months and see what's happening. If we're not seeing much effect with the oral medications after 3 months, the next step is to move on to the injectable medications, which is commonly known as Trimix or alprostadil or papaverine, but they're available at compounding pharmacies or name brand. The injection process is important to start at 3 months because if healthy erections aren't happening, you can develop scar tissue and shortening of the penis. Shortening of the penis is not an uncommon complaint after prostatectomy, and that can be mitigated with using a vacuum device or a penile traction therapy. We can certainly talk about that more. After 6 months of no change in urinary function, we can start to talk about surgical correction of this issue, including things like slings, periurethral balloons, and artificial urinary sphincter. For a man with issues with erections that's not responding to oral medication and then not responding to the injectable medications, we have 2 other options. The vacuum erection device, which can be used for the couple that is sparingly intimate, and then we also have the curative therapies such as the penile implant, and we'll talk about that more later. What actions can you take after treatment to expedite and facilitate my recovery? Well, the first thing is not to ignore the erectile function, okay? The earlier that's treated, the more likely that is to recover. Same thing with the Kegels. As soon as that catheter comes out, start the exercises. And then if penile length recovery is a priority as well, we can look at using a vacuum device to stretch the penis out every day, or a penile traction device to help you get your preoperative length back. The long-term cure for erectile dysfunction after radical prostatectomy or radiation for prostate cancer is the penile implant. 85% of men who've had a penile implant would recommend it to a friend. What's the advantage of the penile implant? You don't have to keep treating the disease. You cure the disease. So the penile implant is a 1-hour surgery, an outpatient stay, a small incision in the scrotum that big, and 6 weeks later you have an erection when you want to have an erection. Your erection goes with you where you go, and it lasts as long as you want. Penile implants are the gold standard for medical refractory erectile dysfunction. Long-term cures available for incontinence. There are 3 options available. When should one consider this? So what we look for is 6 months without improvement in urinary control. So if you go 3 to 6 months after surgery and you haven't seen any improvement at 6 months, so whenever you last saw improvement, 6 months from that point is when you should consider surgical correction of urinary incontinence, okay? There are 3 options available. The first option is the male sling, which is, in my practice, is generally recommended for men who have 2 pads a day or less, and a permanent solution that doesn't require adjustments or intervention in the future. So that's the advantage to the sling, is once you have the procedure, it's outpatient, it takes about an hour, and you get the result you get. Downside to the sling is it doesn't quite work for everybody. We see success rates from 60 to 80% in the low volume leakers, okay? The next option available for men with urinary control issues after prostatectomy is the PROACT balloons. This is a minimally invasive percutaneous procedure designed for men with small, medium, and high volume incontinence. And it's adjustable. It can be adjustments can be performed in the clinic every 4 to 6 weeks until continence is achieved. And we've treated men with up to 8 pad a day incontinence with good results. Results can be varied with radiation. The last option is the artificial sphincter. And this is for men who've been radiated after their prostate cancer surgery or have high volume leakage, as it can be the most effective with 90% 0 to 1 pad a day rates at 3-month follow-up. The artificial sphincter is about an hour-long procedure that's done, outpatient or an overnight stay, and is activated at 6 weeks. It does have a little bit higher failure rate at 50% at 5 years. We'll need another surgery, but it gives the highest chance of being cured of your stress urinary incontinence. Men who've had prostate cancer treatment can minimize penile length and girth issues after treatment by aggressively rehabbing their penis. This, again, like we've discussed, includes early use of oral medications. If the oral medications fail, using the injection therapy, considering the vacuum therapy to help rehab length and girth, and then early use of the penile implant if the conservative measures fail. What things should you do to be staying healthy? Well, take good care of yourself. This is the most important thing. Even in prostate cancer, heart disease is still the #1 cause of death, no matter what the stage. So eat right, exercise, and do things that are good for you.